Welcome to MPUNGWE-PUNGWE YouTube channel. Subscribe for you to enjoy more of our videos anytime we upload.
Thank you very much, First Deputy Speaker. Indeed, we had a meeting during tea break with the Minister of Finance, and the issues have been resolved. We'll be having another meeting probably tomorrow, but you can proceed. Thank you very much, First Deputy Speaker.
Thank you very much. Thank you very much, Government and the Honourable Minister of Finance in specific. That's the way to go, and the Parliament areas where we discuss and agree. So let's discuss and always agree. As we move forward, can I ask the cluster chairs, those that are ready? What cluster is that? That's the cluster on health. You have the floor. Chair, please return to your seat and go the other side of the aisle. So.
Thank you, First Deputy Speaker, sir. I rise to present the Health Cluster Report Committee number 2 on health after scrutinizing the votes in the 2026-2027 national budget through discussions held with various government ministries, departments, agencies, and councils. It is both an honor and a responsibility to stand before this august House today to present the Health Cluster Report. This report reflects the collective effort, careful deliberation, and commitment of the committee to addressing the key health challenges facing our country. It highlights our findings, the progress made, the gaps that remain, and the practical recommendations we believe are necessary to strengthen our health systems and improve the well-being of those we serve. Throughout this process, First Deputy Speaker, sir, the committee has remained guided by the principles of accountability, inclusivity, and evidence-based decision-making. We have engaged the stakeholders, reviewed critical data, and examined the realities on the ground to ensure that this report is not only informative, but actionable. Let me also take opportunity to thank all Health Committee members for electing me as their chairperson, and I would like to promise that I will work with integrity, dedication, and a clear vision for advancing our shared goals. Votes considered. Mr. Speaker, Cluster 2 considered the following program-based votes. Number 1, vote 275, Nurses and Midwifery of Malawi. Vote number 2, National AIDS Commission. Vote number 3, 275, Medical Council of Malawi. Vote number 4, 900 series, National Local Government Finance Committee, District Hospitals. Vote number 5, 275, Red Cross Society of Malawi. And 6, vote number 310, Ministry of Health. Mr. Speaker, sir, the First Deputy Speaker, sir, the cluster also considered the Central Medical Stores Trust following an allocation of 20 billion as a bailout from the Ministry of Finance. Observations, challenges, and recommendations. Number 1, National AIDS Commission. First Deputy Speaker, sir, NAD's allocation increased by 10% from 5.3 billion in 2025-2026 to 5.8 billion in 2026-2027. Out of this, 2.2 billion is allocated to personal emoluments, leaving 3.6 billion for other recurrent transactions. However, activities costing 433 million were dropped, including SBCC campaigns, facilitation of monitoring, stakeholder meetings, zonal reviews, mapping, database integration, pre-exposure prophylaxis advocacy, child protection coordination, interactive media sessions, HIV programming in private and faith sectors, and dissemination of guidelines. The Commission also faces declining external resources, donor fatigue, and limited domestic financing. Community-led initiatives remain underfunded, and vertical coordination structures persist despite overlaps with other diseases. The committee resolved that Treasury should reallocate the 1% levy on construction projects to NAC and ensure that at least 600 million is provided to sustain community-based interventions. This will reduce donor dependency and ensure that Malawi meets the SDGs before 2030. Number two, Nurses and Midwives Council of Malawi. First Deputy Speaker said the council's allocation increased to 270 million, but this remains lower than the 332 million allocated in 2024-2025. The council relies heavily on internally generated funds, estimated at 1.6 billion, up from 1.2 billion in the previous year. Despite this, the council faces a resource gap of 560 million. Monitoring and evaluation of health facilities has been compromised, with only 86 facilities inspected out of 1,000, just a meager 5% coverage. This has led to increased negligence and misconduct cases among nurses and midwives, resulting in public dissatisfaction. The council also struggles with mobility challenges, inadequate vehicles, poor IT infrastructure, and delays in finalizing the review of Nurses and Midwives Council Act, which began in 2015. This committee, Mr. Speaker, sir, resolved that Treasury should intensify funds to cover the 560 million gap. The Council should enforce subscription payments and penalties and develop a resource mobilization policy and clarify which program the government subvention supports to avoid duplication. Medical Council of Malawi, that's vote number 3. First Deputy Speaker said the Medical Council received 298.6 million in government subvention, a 10% increase. The Council's internally generated resources are projected at 3.1 billion, up from 2.3 billion. However, donor funding declined by 54%, and the Council faces a 36% vacancy rate, with critical shortages in compliance, ICT, and finance staff. Budget constraints have hindered inspection, awareness campaigns, and enforcement of professional standards. Only 4 health facilities were inspected instead of 10 due to inadequate human resources. The Council also faces inadequate office space, aging vehicles, and high board expenses. This committee, therefore, resolved that government should expedite approval of the revised Medical Practitioners and Dentists Act and consider exemptions from the recruitment freeze for critical health regulatory staff. The Council should densify fees collection, adopt stringent penalties for non-compliant practitioners, and lobby for financial independence by 2030. District hospitals, which is vote number 4, under National Government Finance Committee. First, Deputy Speaker, sir, the overall budget for district hospitals decreased from 43.5 billion to 28.1 billion, mainly due to removal of rehabilitation funds. ORT increased from 23 billion to 25.3 billion, and the devolved drug budget increased from 2.5 billion to 2.7 billion. However, absorption rates remain low. Chikwawa, Lilongwe, Nkadabe, and Kotakoda did not even recorded any utilization of rehabilitation funds. Other councils delayed procurement, waiting for full funding. Funding performances for rehabilitation was only 24% as of December 2025, while arrears for drugs reached whopping 559.7 billion. This committee, First Deputy Speaker, sir, resolved that resources should be ring-fenced to ensure health facilities undertake their services, and financial reports should be made mandatory. Council should expedite implementation of health-related infrastructure projects, and the Treasury should consider increasing the drug budget from 47.3 billion to meet the quantification requirements of 58 billion. Red Cross Society of Malawi. First Deputy Speaker, sir, the Red Cross Society of Malawi plays a critical role in humanitarian response, disaster preparedness, and health-related interventions. However, the committee observed that its funding remains inadequate to meet the growing demands, particularly in supporting community-level health and disaster resilience. This committee, therefore, resolved that the Treasury should strengthen collaboration with the Red Cross Society, ensure timely disbursement of resources, and to consider additional support for disaster preparedness and health outreach programs. The Society should also be encouraged to mobilize resources from partnerships and community contributions to complement government allocations. Ministry of Health. Mr. Speaker, sir, the Ministry of Health faces challenges in ensuring adequate financing for devolved health services. While ORT and drug budgets have increased, rehabilitation of health facilities has been removed, leaving gaps in infrastructure development. Absorption of resources remain low, with delayed procurement processes and poor utilization of funds for utilities and food rations. Councils often wait for full funding before implementing projects, which undermines safe delivery. The committee resolved that the Ministry of Health should strengthen systems to ensure timely absorption of resources, enforce financial management sanctions, and make financial reporting mandatory. MPs should be part of planning at community level, and material development plans and should be adopted to improve sustainability. The ministry should also ensure that recapitalization of CMST is aligned with district hospital budgets to avoid arrears. Central Medical Stores Trust. Mr. Speaker, sir, Central Medical Stores Trust faces arrears of 71.9 billion, owned largely by district council offices. Forex scarcity has crippled procurement, leading to delayed deliveries, litigations, and foreign exchange losses. The trust also struggles with an aging fleet and inadequate storage space, relying on rented warehouses. The development budget for a new warehouse is at 24 billion, but only 2 billion has been provided under PSIP. This committee, Mr. Speaker, sir, resolved that Treasury should pay Central Medical Stores Trust arrears amounting to 71.9 billion, provide adequate forex to procure medicines, and support completion of the warehouse project. Central Medical Stores should also strengthen supply chain integration and resource mobilizations to reduce the reliance on rented warehouse. Conclusion and appreciation. Mr. Speaker, sir, health is the backbone of our nation's development. Without adequate financing and governance in the health sector, Malawi cannot achieve its social and economic goals. First Deputy Speaker, sir, the Health Committee's report lays bare the harsh realities of our health care system. We are failing to keep up with increasing demands, and it's time we address the root causes. The facts are clear. We have a shortage of essential medicines, inadequate infrastructure, and a brain drain of health professionals. First Deputy Speaker, sir, our professionals are doing their best with the meager resources and low budgetary support against a background of safe demands that keep increasing every day. As a new child is born, it's a race to keep up with the ever-increasing demand against the resources envelope. Each day a new child is born is a new health service demand for the child and mother, a new list for drugs and other health-related services. First Deputy Speaker, sir, we are all witnesses to the donor fright and fatigue. Our budget support has been shrinking, but we are very slow to act with urgency to the donor fright. We continue doing business as usual. First Deputy Speaker, sir, this cluster suggests introduction of sin taxes on products such as tobacco, sugar, and even alcohol. The committee further suggests introduction of toll gates in border districts for revenue generation. However, First Deputy Speaker, sir, the health cluster recognizes the fact that these funds are sometimes prone to abuse. It is for this reason, First Deputy Speaker, sir, that this committee suggests establishment of a national health fund and enactment of national health insurance to reinvest funds generated from these initiatives. All funds and health revenues should be channeled towards the proposed national health fund. First Deputy Speaker, sir, your committee has noted with great concern that government continues to fund projects which are not taking off. One such project is the construction of Mponera Health Facility. In the previous fiscal year, the project was given 2 billion, but the project did not take off. In the 2026-2027 fiscal year, the project has been allocated 1.6 billion again. The cluster proposes that projects which are stalling should not be given further funding. Instead, these funds can be channeled towards construction of the VVIP sections in central hospitals to save funds incurred on external referrals. First Deputy Speaker, sir, this House should be made aware that in 2025-2026 fiscal year alone, government spent over 2 billion on referrals. Huge amount of money, First Deputy Speaker, sir, that can be saved. First Deputy Speaker, sir, this cluster appreciates several local resource mobilization drives government is implementing, such as paying wings in health facilities. In the previous fiscal year, the Central Medical Stores and the Ministry of Health generated 3.5 billion through paying services. These are funds which are used by these facilities when funding from the central government delays. But your committee, First Deputy Speaker, sir, would like to categorically state that while it supports the local mobilization strategies, it wants to see the most vulnerable people being protected from such initiatives. Finally, Mr. Speaker, sir, allow me to express my sincere appreciation to you for granting me the opportunity to present the findings, observations, and resolutions of Cluster 2. I also extend gratitude to the Secretariat and to the ministries, departments, and agencies that engaged with us during this process. Mr. Speaker, sir, I beg to move.
Thank you. Thank you. Thank you. Honourable members, we can do better. Another hand of applause to the Honourable Chairperson. Thank you, cluster number 2, the health cluster. I don't know, members, this is the way we should be presenting our issues, very optimistic and positive, considering that the budget is for all Malawians. Honourable members, can I recognize the next taker? Cluster number 1, where are you? Cluster number 3, cluster number 4. Okay, Chair, what cluster is that?
Mr. First Deputy Speaker, this is cluster number 3, a cluster on social and community affairs and local authorities and rural development. Thank you.
Chair of chairs, you have the floor. Thank you. Chair, you can proceed.
Mr. First Deputy Speaker, sir, I am honored to stand before this.
Chair, for the sake of those that doubt your adherence to time, you have 20 minutes, Chairperson.
Thank you very much, Mr. First Deputy Speaker, sir. Much obliged. I am honored to stand before this honorable House to present the findings and the recommendations of the Cluster Committee number 3 on social and community affairs, local authorities, rural development, following the scrutiny of the 2026-2027 budget estimates. In the course of its deliberations, the Cluster Committee engaged various ministries, departments, and agencies, as well as key stakeholders, in order to assess the adequacy, efficiency, and likely impact of the proposed allocations on the social and community sectors, as well as the local authorities. Mr. First Deputy Speaker, sir, on behalf of the Cluster Committee, allow me to express my sincere gratitude to you for the confidence placed in us to undertake this important responsibility. I also wish to commend honorable members of the Cluster Committee for their diligence and commitment to recognize the Secretariat for the invaluable technical support rendered throughout this process. In a special way, Mr. First Deputy Speaker, we want also to appreciate the presence of the officials from the Ministry of Finance who were taking some of the activities and giving us some immediate responses to some of the issues that we raised. Their input was so valuable, Mr. First Deputy Speaker, sir. Mr. First Deputy Speaker, the Cluster Committee considered vote 350 for Minister of Labour, Skills and Innovation, vote 320 for the Minister of Gender, Children, Disability, Social Welfare, and vote 180 for the Minister of Youth, Sports and Culture, vote 120 for the Minister of Local Government and Rural Development, vote 121 for the National Local Government Finance Committee, and vote 275 for the subvented organizations. The first vote to be considered was the Minister of Labour, Skills and Innovation. Mr. First Deputy Speaker, sir, the cluster notes that while the ministry plays a pivotal role in promoting employment, skills development, and labor protection, it continues to face significant funding constraints, which are adversely affecting the implementation of key programs. The Cluster Committee observed that inadequate funding for TVET examination, certification, and the operations of the national technical colleges, which risks disrupting examinations and undermining the development of skilled labor force. The Cluster Committee further noted that the graduate internship program lacks operational funding for effective coordination, monitoring, and accountability, despite provisions for interns' stipends. Mr. First Deputy Speaker, sir, the Cluster Committee also observed that the Minister of Labour, when it comes to labour market information systems, remains underfunded, thereby limiting its capacity to generate reliable labour market data necessary for evidence-based planning and, in addition, guidance. In addition, the Cluster Committee expresses concern over outstanding workers' compensations claims exceeding $2 billion, with no specific allocation provided to clear these arrears, and notes that the Workers' Compensation Fund has not yet been operationalized. Mr. First Deputy Speaker, sir, the Cluster Committee therefore urges the Treasury to provide additional resources for TVET examination and the technical colleges, allocate adequate operational funding for the graduate internship program and the labor market information system, to prioritize the settlement of outstanding workers' compensation claims and expedite the establishment of the Workers' Compensation Fund Secretariat, and support the completion of community technical colleges and expansion of specialized training facilities. We considered a vote on TVETA, which is the Technical Entrepreneurship and Vocational Education and the Training Authority. Mr. Speaker, sir, the cluster notes that the TVETA operations are constrained by the accumulation of the TVET levy arrears amounting to approximately $5 billion by today, which has significantly limited its capacity to implement key programs, including infrastructure expansion, recruitment of instructors, and apprenticeship training. The Cluster Committee further observed that development funding for the community technical colleges remains inadequate, with critical projects such as in Towe and Ngara community technical colleges remaining unfunded. Mr. First Deputy Speaker, sir, the Cluster Committee also notes that many technical colleges are operating with very high teacher vacancy rates, in some instances reaching up to 40%, which has serious implications on the quality of the delivery of the training. Furthermore, access to post-secondary skills training remains limited despite increasing secondary school completion rates, and the absence of harmonized qualification framework continues to affect standardization and recognition of TVETA qualifications. Mr. First Deputy Speaker, sir, the Cluster Committee therefore urges government to prioritize the settlement of the outstanding TVET levy arrears, allocate additional resources towards the completion and expansion of technical colleges, and address the critical staffing gaps, and develop and adequately fund a national certification and qualification framework aligned to the regional and the international standards. I just wanted to remind this Honourable House that in the initial plans for TVETA, there is needed to construct one technical college or skills center per each constituency. And again, Malawi also is lacking what is called the Technical Teacher Training College. So our technical instructors have nowhere to be trained. As such, most of them are teaching there in just their acting capacity, as they don't hold the necessary qualifications. Minister of Youth, Sports and Culture. Mr. First Deputy Speaker, sir, the Cluster Committee notes with concern that the declining funding for youth development programs may significantly constrain the implementation of key initiatives, including policy dissemination, psychosocial support, and youth participation in the national development processes. This reduction risks reversing the gains made in youth empowerment and engagements. Mr. First Deputy Speaker, sir, in the sports sector, the Cluster Committee observed that the National Indoor Sports Complex remains incomplete, and this is the Griffin Saenda Sports Complex, due to prolonged funding constraints, while major facilities such as Bingu National Stadium and Kamuzu Stadium continue to face operational challenges due to inadequate funding for maintenance and utilities. The Cluster Committee further notes that the revenue-generating potential of these facilities remains largely underutilized, thereby limiting opportunities for sustainability. Mr. First Deputy Speaker, sir, the Cluster Committee therefore recommends that the Treasury should consider increasing funding towards youth development and empowerment programs and prioritize the completion of the National Indoor Sports Complex and strengthen the management, maintenance, and the commercialization of national sports facilities. I just wanted to also bring to the attention of this Honourable House that as we stand today here, there is no an internationally recognized or qualified sports facility either in the southern region, to be specific in Blantyre, or in the northern region, to be specific in Mzuzu. The only facility that has been qualified is the Bingu International, the Bingu National Stadium. So as a cluster, we are of the opinion to make sure that the ministry should actually at least finish one sports facility in the south and one sports facility in the north to the international standards as required. The National Youth Council of Malawi. Mr. Speaker, sir, the Cluster Committee was particularly concerned with the allocation to the National Youth Council of Malawi. The Cluster Committee observed that there is no development allocation for the Achinyamata Center in the 2026-2027 financial year, despite preparatory work already undertaken, which had costed the institution about 1 billion kwacha in the previous budget. This risks delaying implementation and the mobilization of cooperating partners. The Cluster Committee further noted a significant reduction in the Council's overall budget allocation by 28%, which may adversely affect the delivery of youth empowerment programs. Mr. First Deputy Speaker, sir, the Cluster Committee, therefore, strongly urges Treasury to allocate development funding towards the Achinyamata Center and to review and increase the Council's overall budget allocation in order to support effective implementation of youth development programs. Ministry of Gender, Children, Disability and Social Welfare. Mr. First Deputy Speaker, sir, the Cluster Committee notes that with serious concern that the allocation to the ministry has declined from 69.6 billion in the 2025-2026 financial year down to 47 billion in the 2026-2027 financial year, representing a reduction of approximately 32%. This substantial reduction is likely to adversely affect the delivery of essential services to vulnerable populations. Mr. First Deputy Speaker, sir, the Cluster Committee observed that the Social Cash Transfer Program continues to face a significant financing gap, thereby threatening its sustainability and expansion. The Cluster Committee further notes that with concern that the elderly services sub-program has not been allocated any resources despite the increasing need. In this one, Mr. First Deputy Speaker, sir, the issue is that we passed a law here in Parliament which requires that the elderly should be should be supported with something on a monthly basis, and that falls under the elderly services, and nothing has been allocated to this very important program. In addition, key programs under child development and protection, as well as gender equality and women empowerment, remains underfunded. Mr. First Deputy Speaker, sir, the Cluster Committee also observed operational constraints affecting critical institutions, including limited funding for the National Children's Commission, which requires adequate resources to operationalize its mandate. Mr. First Deputy Speaker, sir, particularly concerned also the persistent governance and capacity challenges to Makoda. The Cluster Committee was informed that the key senior management position, including Director of Rehabilitation Services and the Director of Finance and Administration, have remained vacant for over 7 years now. The Cluster Committee further notes that the contract of the Director General has expired, raising serious concern regarding the institutional leadership and accountability. Mr. Speaker, sir, the situation reflects systematic governance weaknesses, particularly given to the government as government continues to cite capacity challenges while failing to fill critical positions necessary to build that capacity. The Cluster Committee is further concerned about the implications of the challenges of the management of the Disability Trust Fund, which is presently managed by the Ministry of Gender, and yet the Act places that responsibility with Makoda. But unfortunately, Makoda doesn't have all the financial or the staffing capacity that this fund might have required. Mr. First Deputy Speaker, sir, therefore the Cluster Committee urges government to reconsider the reduction in the ministry's allocation, to prioritize funding for social protection programs, the state funding for the elderly services, and allocate about 850 million to the National Children's Commission, and urgently fill all vacant senior management positions, especially for Makoda as a special case. And again, to regularize the leadership at the Director General's level and strengthen institutional capacity and ensure that the Disability Trust Fund is administered in accordance with the decision of this Honorable House. As I go towards the end, Mr. First Deputy Speaker, we also had an interaction with the Minister of Local Government and Rural Development. Mr. Speaker, sir, the Cluster Committee noted that the ministry's ORT allocation has declined from 6.3 billion to 3.8 billion, representing a reduction of approximately 40%, which has significantly constrained its oversight capacity. The cluster committee further observed that inadequate funding for counselors' orientation, limited resources for monitoring the Constituency Development Fund, and persistent transport constraints. Mr. First Deputy Speaker, sir, as we speak today, all the councillors have not yet been oriented on their work. So we shouldn't be surprised when they will be making something which is not part of their work, contrary to what is required of them. The cluster committee also notes delays in the disbursement of the development fund, including the CDF, and the capacity challenges within local authorities which continue to affect project implementation and service delivery. Mr. Speaker, sir, the cluster committee therefore recommends that Treasury should consider increasing the ORT allocation to at least 6 billion and provide funding for council orientation and CDF monitoring, strengthen technical capacity in local authorities, and ensure timely disbursement of funds. Kachere Rehabilitation Center. Mr. First Deputy Speaker, sir, the cluster committee notes that despite its critical role in providing rehabilitation services, the center has been allocated 1.145 billion under the ORT with no development budget. This has significantly limited its ability to upgrade infrastructure, procure modern equipment, and expand services. The cluster committee further notes that the development proposals amounting to approximately 1.61 billion were not approved. The cluster committee also observed that critical gaps in the outreach capacity, such as lack of ambulances, outdated equipment, and infrastructure challenges are affecting the delivery of services for this institution. Mr. First Deputy Speaker, sir, the cluster committee therefore recommends that Treasury should provide a dedicated development budget for the center, reconsider unfunded development proposals, and prioritize procurement of ambulances and modern equipment to support infrastructure improvements, strengthen institutional capacity, and promote sustainable resource mobilization strategies. In conclusion, Mr. First Deputy Speaker, sir, it is considered the view of the cluster committee that the issues raised require urgent and deliberate attention if we are to achieve inclusive and equitable development accordingly. Allow me, Mr. Speaker, sir, to conclude by expressing my sincere appreciation to the Minister of Finance in a special way, because we had an interaction during the tea break, as you had directed, Mr. Speaker, sir, that whatever we have raised here together with the other cluster committees, he is going to grant us a longer discussion, probably by tomorrow, so that we give him a proper feedback, and then we discuss with his office. I would like, on behalf of all the cluster chairs, on this note, Mr. First Deputy Speaker, sir, to congratulate the Honourable Minister for granting all the chairs of the cluster committees and the audience to give him our feedback in person and have a further discussion. If you may allow, Mr. First Deputy Speaker, to ask the Honourable House to clap hands for the Honourable Minister of Finance for that gesture. With these remarks, Mr. First Deputy Speaker, sir, I beg to move. I want to thank your office and also the entire House for your attention, and as such, I want this report to be adopted by this whole House. Thank you very much, Mr. First Deputy Speaker, sir.
Thank you, Chairperson. Thank you, Chairperson, for that presentation. And I see the Honourable Member for Cholo Central, who is also the Honorable Minister of Local Government, rising. Why are you rising, Honorable Minister?
Thank you very much, Right Honorable Deputy Speaker.
After your speech, please send my greetings to the Honorable Member for Luchenza Municipality, who happens to be in the House. Thank you.
Actually, that is the more reason I'm rising up, because he did ask me to stand up and send his greetings to you. But I'll take advantage just to, probably if allowed, to put it on record that with the assistance of the Minister of Finance and indeed other partners, the orientation for councillors has started. I'm highlighting this because it was pointed out that it has not yet started. It is a rigorous process because it has got to be done across the country, but we have started as we speak right now. The trainings are in Blantyre. We have started with Mango Chibalaka and Blantyre because of the volumes. We need smaller classes. So I wanted to put it on record that the orientation for councillors have indeed started, Right Honourable Speaker. Thank you.
Thank you very much. Chair Social and the Chair for the Cluster for Local Authorities, Chair of Chairs. Chair, you seem to be taking a lot of your time greeting a lot of women than men. Is that because you are the social chairperson?
Mr. First Deputy Speaker, sir, I wanted to make sure that the Committee on Social is the one responsible for the welfare of women. And that has to come clearly on record. Thank you, Mr. First Deputy Speaker, sir.
Thank you. So while you're doing that, the Honourable Minister of Local Government made an announcement to say the training for councillors has resumed in Malawi, and they have started with 3 districts. So you might need to oversight on that and liaise with the Honourable Ministers. Thank you very much, Honourable Minister. This will help the relationship between honourable members and councillors to understand our roles and contribute to the national development. Honourable members, before I suspend for a lunch break, I have another announcement. 1 or 2 groups. We are so lucky that we are getting so many visitors attending Parliament. We are becoming so popular out there. I think very soon we'll turn ourselves into celebrities. I see there's a grouping of another 58 students. This is from the same school, Dalo Girls Private School. They had to stay outside because there was a big number. So the first group is gone. This is the second group. So Dalo Private Girls Secondary School from MPUNGWE-Kampuno constituency, please rise. And the Honourable Member for MPUNGWE-Kampuno, please rise. Can I request the Honourable Deputy Minister of Education to rise and wave at the students from Dalo Girls Private School. Welcome to Parliament, and the Deputy Minister of Education has welcomed you on behalf of us all. Welcome, please take your seats. The next group is a group coming from Lilongwe City Mloza constituency. They are 120 students from Kodacom Private School. If I haven't pronounced your name well, please, you forgive me. Kodacom Private Schools, please rise. Can I request the Honourable Member for Moloza to rise and wave at those students? And request the Honourable Deputy Minister of Gender to rise, and the Deputy Whip of Chief Whip of the government side rise and wave at those students, please. Thank you very much. Thank you very much. And welcome to Parliament. Go ye and work very hard in various academic achievements and be what you want to be, because the skies will never be the limit to your success. I hope I have represented all the visitors in the gallery. If there are other visitors I haven't recognized, please, it's not out of choice, but because I haven't been communicated. But all visitors that are in the gallery, welcome to Parliament, and enjoy your stay. It's very unfortunate our budget does not cover lunch or breakfast for visitors, so please enjoy your lunch wherever you are taking it. It's now 12:30. We will continue with the clusters after lunch. So Chair of Chairs, make arrangement for the cluster chairpersons to be ready and available. If by no means a cluster is not available, we've already have interest for honor members who are ready to debate the budget. So we will be alternating. When we don't have chairs available, we will, because we only have this week, honor members. So let's take up our challenge only this week to debate the budget. According to the motion, the leader moved to the House yesterday. We need to get this done, and next week we should move into the Committee of Supply.
Welcome to MPUNGWE-PUNGWE YouTube channel. Subscribe for you to enjoy more of our videos anytime we upload.